Broadcasting from New York City to the world, it's the G-Man Interviews.
Welcome. Last month, Jack Halpern, founder of the New York City-based My Elder Advocate LLC, appeared on this show and explained why abuse by home health aides has reached a crisis point in New York, as well as other sections of the country, and what can be done to address the problem. Joining me to discuss the episode and this pivotal issue is Joseph Addabbo Jr., a Democratic member of the New York State Senate from the 15th District in Queens, which includes Howard Beach, Ozone Park, Woodhaven, Glendale, Middle Village, Maspeth, and parts of South Ozone Park, Ridgewood, Woodside, and The Rockaways. He attended Nativity BVM School in Ozone Park and Archbishop Molloy High School. He received degrees from St. John's University and Touro Law School and practiced law for 10 years at Addabbo and Greenberg before being elected to the New York City Council in 2001. He was re-elected 3 times and served as a council member for 8 years. His father, Joseph P. Addabbo Sr., served 13 terms in the United States House of Representatives. Senator Addabbo is a member of the Senate Standing Committee on Aging, which addresses key issues that impact the elderly. Thank you for joining me, Senator.
G-Man, good to see you.
According to Mr. Halpern's research, the situation has reached a crisis point in not only New York State, but across the country. Were you or your colleagues in the Senate aware that things were this bad and getting worse?
Probably the short answer would be no, considering that there's no real pieces of legislation addressing the issue of home care and the victimization of people being taken care of. That being said, it's an issue that I believe the state should address. The issue of home health care has been an important issue for us in terms of funding in the budget. We have moved along as a state to try and keep people in their homes, cared for and healthier so that they're not in our hospitals, because every time somebody goes into the hospital, there's a cost to the state. So the idea of keeping somebody home and healthier has been a trend in our state, but not looking at those who might fall victim to either physical abuse, verbal abuse, or worse, really hasn't been a major issue approached to us in the state Senate or the Assembly.
A few days ago, Mr. Halpern informed me that the Bronx is the worst out of all the boroughs in terms of elder abuse, which is why your colleague, Senator Reverend Ruben Diaz, and his son, Borough President Ruben Diaz Jr., were contacted and asked to provide comments. Mr. Halpern went on to say that Queens comes in a very close second. To be fair, though, I'm not sure if your district is among the areas he focused on in his research. Having said that, has your office received complaints about elder abuse in private homes or senior care facilities?
Well, first I'll say that I don't believe any particular community is going to be immune from this issue, whether it be the Bronx, Queens, or even Brooklyn, Manhattan, or Staten Island. I don't think any community is immune. I think we have this issue out there throughout every corner of our city. We have had, complaints from nursing homes and other entities in the past come to the district office, but nothing of prevalence or nothing of great numbers. But I know the situation is out there. My biggest concern is that the silent victim is out there. Those that are victimized as seniors in their homes are not coming forward due to the fact that they may be concerned about the ramifications or the fear of the repercussions if they do step forward. And that is something that we're going to have to raise awareness to. Where seniors can turn almost in a confidential manner that tells of a story that they've been abused, so that we can alert the authorities to crack down on the situation and save their lives. So I think there's a certain awareness that has to be put out to the seniors, to the general public, that they need to speak out about this issue. I know in Queens we have one of the largest populations of seniors in their homes, and the idea here is I wouldn't be surprised that we're number 2 in abuse. But like I said, it doesn't take any particular borough or any particular community to identify this issue as a serious issue.
And speaking of abuse, I understand that you personally experienced this situation.
Yeah, my mom was a victim of a person who was a home healthcare aide. And while my mother wasn't victimized as this person was watching over my mom befriended this person And this person used that friendship to take money from my mother. When we found out about it as a family and alerted the NYPD, the police ultimately arrested this woman, which we found out she was a home health care aide and previously was let go as a home health care aide because she was stealing and robbing both jewelry and money, and there was a certain level of abuse to the seniors that she was watching over. So we know the issues out there. And again, my mom was fortunate enough not to be a victim of the home health care aide herself, but nevertheless, we know the victims are out there, and they're elderly, and the elderly are such a large population of being victimized by these home health care aides because they're so easy to prey upon. Most elderly individuals are trusting people, and they look toward the home care aide for help and assistance in their own well-being. So these seniors are easy prey, and these home healthcare aides know it. Now, I'm going to venture to say that the vast majority of home healthcare aides are good people. They are dedicated people, committed people. They don't get paid a lot of money, and so they're not in it for the money. They're in it to help others, and we appreciate their work. This is a situation where a few ruin it for the many. Much like what we have in our state legislature. But we need to identify those few who are ruining it for others because they are jeopardizing somebody's health and, in some situations, their life.
Yesterday, I spoke to an employee at North Shore LIJ Health Systems who asked that I conceal his identity. He stated the following: I watched your episode and was shocked to learn that most home health aides undergo poor background checks and aren't required to be fingerprinted in New York State. It's equally disturbing to know that many of the agencies that hire them aren't required to fingerprint their employees. I know for a fact that people working in the housekeeping division of North Shore LIJ Health Systems go through extensive background checks and must be fingerprinted. The requirements are strictly enforced. It's insane that home health aides don't have to go through this, especially since they're closely interacting with patients. I don't understand how or why this practice has been allowed to continue. Senator, why haven't home health aides been held to the same standard, legislatively speaking, in New York State?
I can't say why they haven't in the past, but I think we need to move forward. And the idea is, based upon the awareness that you have raised, both not only with this interview, but certainly the information that you've put online, that we need to look at this legislatively on the state level. People's lives, people's health are at stake. So we need to protect them in a better fashion, and this discussion has to be brought up to Albany. It's not, again, only limited to New York State. This is a national issue. And I wouldn't mind if federal government would take this up at some point as well. But I think, as we wind down to an extent our current legislative session as we end up in June, we use this time, certainly I use this time to prepare even for the next legislative session. So we'll start looking into what, has not been done by the state with its current set of laws with regards to home health care and where we can improve by creating new legislation in order to protect those in their homes.
During my interview with Mr. Halpern, he also revealed that leading elder care agencies, such as Excellent Home Care, received what he called a slap on the wrist after being convicted of defrauding the government of millions of dollars. He cited cronyism and political favoritism as the reasons why the agencies continue to pay minuscule fines. Is a politics-as-usual attitude impeding efforts to implement effective policy changes where this issue is concerned?
I would hope not, because that would mean that the money aspect is coming before the health of an individual. Albany has been plagued in the past with obviously money dictating policy. Now we're trying to change that ideology up in Albany and having money have less influence amongst our legislative process. That being said, again, I'd hate to think that it's money that obviously protected these wrongdoers. That would be part of the aspect that we look at when we go forward legislatively on this issue.
Would you consider drafting legislation requiring every home health aide in the state of New York to undergo extensive background checks and to be fingerprinted?
It's that kind of legislation that we're going to look to move forward. Now, there'll always be ramifications. Do we lose, quality home health care aides because of this situation? This is what we do legislatively. We start with an idea, a valid one, and we have one here. And now we go forward. And the language of the legislation will be drafted so as to protect the individual and to protect the good home health care aides that are out there.
Now, you're a member of the Senate Standing Committee on Aging Is this something that you'll present to your fellow senators?
This is a discussion that I'll have with its chair and our legal counsel.
Is there anything you'd like to say in closing, Senator?
That I know there's a growing population of elderly residents, and it's a growing population that we're going to need to protect. The trend in the state being that these elderly individuals are being healthy in their home. If that is the trend in the state, as I believe it is, then we're going to make extra efforts to make sure that they are safe in their homes.
Thank you for your time, Senator.
Thank you, Gary. Always a pleasure.
I'm the G-Man, and I thank you for joining me. Until next time, stay cool, stay safe, and stay informed.